something that's so great about being able to study the implementation of this program is all around better understanding the complex set of work that jails have taken on. So the justice system is often doing a lot of work to deliver this type of healthcare that can go unrecognized. And so part of what we're doing is also just sort of uncovering or revealing all that it takes to implement a program like this one, and what works well, what is challenging, and to create sort of a set of lessons learned that can be shared with other justice systems elsewhere.
And I think we're very fortunate to have a large group of research assistants who are present and embedded within the houses of corrections across the state. They're able to help curate, compile, clean, manage the data that ultimately fed into the public health data warehouse at the Massachusetts Department of Public Health. And they're often able to give us information on some of the latest developments and some of the latest successes and challenges within each of the houses of corrections.
One key factor is, of course, leadership. That there is leadership and buy-in amongst the staff at the houses of correction around the delivery of a program like this one, and that it isn't just at the leadership, it's down to the line staff. Like a belief in we can implement this and it is effective if we can implement it well. So that's one facilitator of implementation of a program like this one.
And I mentioned this before, jails have a tendency to be very siloed from other parts of the community. And so there's all these kinds of like cultural, logistical barriers. And jails sometimes have a tendency not to, have rigorous data collection. I think that we face a lot of challenges. And, with the pandemic, we don't want to concentrate people in jails. So people are having very short stays in jails. And it's really hard to induce someone on buprenorphine or methadone, do continuity of care planning, conduct that physical, do the behavioral health checks. And in like 4 days, not so easy to pull that off. And that's what we're doing.
And when it comes time to release happening, some of the barriers and facilitators really revolve around communication, interagency communication between staff in the House of Corrections and the agencies to whom they'll be referring patients for continued medication for opioid use disorder treatment. So coordination is key. Information transfer, whether over the phone, whether through electronic medical records, are key to seamless treatment continuity post-release. And then pre-release planning is paramount. This includes ideally pre-scheduled dates of release and medication that can help to bridge gaps in that time from release to getting the prescription on the outside and then getting to a pharmacy. Those are some of the key issues that come into play that, if they're done well, can really facilitate the process. If not, they can be major hurdles